Well, good morning. How do you feel? Well, thank you for coming bright and early, and also some of you maybe had to come up the stairs. We've changed room, but I think it's all going to work out well for us. We want to welcome you to the Medical Wellness Forum. This is our first one in Los Angeles. We've been around the country. We've done several in Chicago, Washington, D.C., Houston, San Francisco, San Diego, but this is our first visit to Los Angeles, and we're glad to be here. The Medical Wellness Association hosts the Medical Wellness Forum, and this is our 10th year in providing this education and training. We also, as a professional association, we have many partners, and some of our partners are here, and we just want to acknowledge them. Obviously, we worked for the past 5 years at the International IRSA Conference and provide medical and wellness education and programs. We also work with the IFPA, Dr. Jim Bell, who is here, as well as the American College of Wellness, the Association of Worksite Health Promotion, as well as even organizations like the Red Cross and other medical associations, A4M, and the World Anti-Aging Network. We're going to focus, and we do have a great program, I'm sure, as you can see, world-renowned speakers, faculty. Many of them have published popular books, and they'll have those books here for you today for you to review, or the signed books for you. But we're going to focus on really the state of the art. We're going to focus on the trends and what new opportunities there are for those of you interested in the medical wellness profession as well as business. And then we're going to also highlight some of the more successful at integrating medical and wellness programs. And then partnering. What are the opportunities to be partnering with other businesses and other community organizations? Now, what is wellness? I'm sure we'd all have different definitions, and that's clearly why we have defined medical wellness. But really, wellness, there's a lot of variations or truths to wellness. Wellness is multidimensional. Wellness is holistic. Wellness changes over time. Wellness is individual, but it also is influenced by the environment in which we live. And finally, wellness is a self-responsibility. And with the wellness continuum, we like to adopt and use the Dr. John Travis Wellness Continuum. I know that you are most aware of. In looking at disease and premature death as going to optimal wellness, high-level wellness, and seeing where from acute care to chronic care across the healthcare continuum, as well as medical wellness programs, what are helpful. And with that, we define medical wellness as the practice of health and medical care relating to proven wellness outcomes. We really want to see measurable outcomes and evaluations in order to define a program as a medical wellness program. That doesn't mean there aren't maybe services or treatments that are being identified as a wellness program, but we would not recognize them as a sanctioned medical wellness program. The more specific definition is an approach to delivering care that considers multiple influences and modalities of health, treating and preventing disease, as well as promoting optimal well-being. And with that, I really love the World Health Organization's definition of wellness, is that health is defined as a state of optimal well-being. This is an interesting chart I like to do. Do you have any people that do any market research or look at different market segments? This is kind of breaking down wellness and medical wellness into clusters in various groups. And you can see that we have with the reactive side is more of the traditional medical care, disease management, and then the proactive would be more of the wellness approach. And you can see where different market clusters group and where but clearly, wellness from birth to death benefits anyone in any acute or chronic state of health. And to take it further, to look at maybe the financial impact and how wellness has really become such a global phenomenon and is really increasing its brand, is the estimated global market size of the wellness industry. And this breaks it down into some of those market segments or clusters. And you can see, obviously, we're approaching several billion up to trillions of dollars in the market potential. Now, as far as the trends, you're going to have many of the keynotes, and also what I think you're going to enjoy today, they'll focus, we have several panels with experts that will be providing, new trends in their specific specialty or practice. And when we get into that, I think it's important to note that there clearly are more wellness-friendly medical and allied health practitioners. But what is clear is that medical wellness has become a brand. We really find it's even probably more dominant in Europe and Asia, but it's coming to the United States, and that people seek out. For example, if you Google or do a search on medical wellness, you'll find all types of businesses in mid-Europe, like Germany, Switzerland, Austria. It's really become, even from a restaurant, food, to hospitality, as well as healthcare. And then there's been the big merge of active aging, and we're a partner and support the International Council on Active Aging, as well as the anti-aging. We also work with A4M Group. Many of our speakers are fellows with the American Academy of Anti-Aging Physicians. There's also a phenomenon in the community. How many of you can look to your community? How many, let's say, your alma mater, where you went to school, how many of you now have a 20 million, 50 million, or at least, I got my doctorate at Ohio State. They have a wellness center that was over $100 million. So the universities have really changed what used to be the recreation program into wellness because of the market appeal. But also from YMCAs to JCCs to health clubs, fitness centers, wellness centers. And we're also finding work sites that many corporate programs are looking at wellness from a screening assessment as well as programming to target specific health risk within their employee population. And then I'm sure some of you, I know we have physical therapists in our audience this morning, is the whole increase where physical therapy, instead of focusing more on acute care, has moved more into medical wellness. And we have partners that are actually developing very innovative medical wellness programs out of their business units. And then with that is the whole phenomena of performance, is not only with performance training for athletes, but also performance training for children, performance training for the corporate athlete, for the work site. And then the integrative medicine that we're going to have our keynote coming up, particularly focusing on, but stress, work, family, and then some of the Eastern and movement arts. Now, some of the best partners that we find that are wellness friendly would be physicians, particularly primary care physicians, that see that most every patient they have would benefit from wellness and health promotion programming, as well as podiatrists. Chiropractors are very wellness friendly, and we're even starting to see some of the sports medicine orthopedic specialists even some of the neurologists and internists becoming more and more involved. We're also seeing clubs and hospitals in some markets working together, also working with some schools in their communities. We're seeing where many clubs and fitness centers want to have a therapy component and some medical programs on site, and also developers. Developers are seeing medical wellness as a way to help market and bring in new consumers. So in a typical medical office building or physician office building, we're seeing they're almost putting a wellness concierge right there in the medical office building that really attracts business. And you can kind of see the genius of that is everyone that comes into that campus would benefit from some type of wellness service. And so why just have someone giving basic information when they could be referring to a specific physician or one of your wellness programs? And then clearly the integrated sports medicine and medical wellness spas. Now this kind of concludes as far as moving in, we're going to be moving into integrative medicine, but medical wellness fits well because it is proactive. And in the medical wellness side, wellness centers, health clubs, fitness centers, and spas can link up with progressive medical sectors to help enhance people's health and life quality. What if there was one prescription that could prevent or treat dozens of diseases, such as diabetes and obesity, hypertension? We're going to have in some of our sessions and around the room today some good screenings and assessment for those. But clearly, exercise and the whole exercise is medicine is a major movement going around the world and internationally. And Dr. Bob Salas, who we meet with and also look forward to working with in the future, that we are also a partner in that professional affiliation. And just on a personal note, you know, why I'm here because I enjoy seeing each of you and meeting new people each year, and I love what I do. But something that's very meaningful to me and really hits my core is for the past 6 years, we have partnered with some medical associations in the Red Cross in other countries. And in this case, this is in the Philippines. And this is a wellness program that we designed with the Red Cross and some other organizations that targets young school children that have significant health risk and provide health improvement and wellness programs to help keep them healthy. And this is one school that we kicked it off in northern Manila. Manila is a very large city. But this one elementary school had over 15,000 students. One campus, 15,000. Now you can say, how did they do that? Well, they had to have 6 shifts to accommodate that. But to kick off with these children was so touching and hit me so hard that I want to continue to go back. We've just signed for another 3 years to help partner and provide resources and services for this. And with that, as you're going to hear throughout the day, exercise is medicine, nutrition is medicine. I'm sure Dr. John LaPuma, Chef MD, is going to say food is medicine. But clearly, all those are components of wellness, and they fit within the wellness curriculum.